there. Today's topic is gut health. This is one of the areas that you have the ability to control more than most. Your gut is only getting rid of and working on what you give it. Depending on what you feed your gut, that's how it's going to act. And one of the best ways of evaluating what your gut is doing is by looking at what's coming out. So check out this chart. Yes, it's exactly what you think. This is a chart that represents different looks to your stool and what they mean. And so if you look at a type 1, hard little lumps, you're most likely constipated, sausage-shaped but not lumpy. Maybe you're not getting enough fiber in your diet. Sausage-like but with cracks on the surface, you get the idea. And so by looking at what type of stool you're having, it can help identify what's going on up above, what you're missing, what maybe is bothering you, or at least tell us that we need to do some testing to find out what's going on. A couple of things that your gut does for you. You absorb your nutrients in your gut. You start absorbing in your stomach, and as you go through the small intestine, most of the nutrients are absorbed at that part. Your water is reabsorbed through the large intestine, and so your entire gut plays a role in digestion and nutrient absorption. Immune function. About 70% of your immune system is in your gut. The mucosal lining protects you from harmful pathogens like bacteria, viruses, even toxins. Your microbiome balance is so incredibly important, and it's also pretty controllable. You have good guys and bad guys that live in your gut, and the good guys obviously help you, the bad guys hurt you. And so the better the balance is of the good guys to the bad guys, the more diverse those bacteria are, they perform different functions, the healthier your gut is going to be. Think of it as a fish tank. You've got good guys, you've got bad guys, you've got fish that do the cleaning, you need fish food. Mental health. Mental health comes from your brain. The gut-brain axis is something that's a topic of hot discussion and exploration right now. And the fact that our gut is so tied to our nervous system is just super cool, in my opinion. The majority of your dopamine and serotonin actually comes from your gut. When your body breaks down, actually when your body's microbiome breaks down some of the amino acids that you take in through your diet, it actually helps to create these chemicals. Weight management. Healthy weight management starts with your gut. If your gut is not functioning well, you're not going to absorb nutrients well. If you're not absorbing nutrients well, your metabolism will not function well. If you're not excreting your old hormones, toxic chemicals, metabolites, they're building up in your bloodstream, causing bloating, GI distress, backing up into the liver and making the liver not function well. It's a snowball effect. Inflammation. Your gut lining plays a huge role in controlling inflammation. Detoxification, we talked about in previous modules. We've got to get rid of what's going in. The only way it's going to get out is through your GI tract or your urinary tract. Allergy and autoimmune disease protection. Your immune system is regulated by your gut. Some things to remember is your diet can provide a lot of the probiotics that you need. However, if you are getting these live cultures from canned foods or foods that have been treated, that might have killed the live cultures, so be careful. If you're taking a supplement probiotic, I would recommend doing a spore. Spores become activated once they're in your colon. They're not going to die on the shelf, and you don't have to refrigerate them. There's a link here for my GI protocol in Fullscript where I have a line of probiotic. Here's a link to my GI protocol in Fullscript, and you'll find my favorite probiotic, which is spore-based, in there. Staying hydrated, making sure you're hydrated will provide for better stool movement. Since excess water is absorbed through your large intestine, it has a lot to do with the consistency of your stool. If you don't drink enough and you dry out your lower GI tract, you're going to be at risk for hemorrhoids, and hemorrhoids are no joke, folks. Stress management, yoga, meditation, mindfulness will also help your GI tract function a little bit better. Regular exercise will help your gut move, decrease antibiotic use. Antibiotics will destroy your microbiome. They're killing all bacteria, good guys and bad guys. You don't get to choose when you take an antibiotic which bacteria are getting killed. You're going to lose them all. Avoid smoking and excess alcohol. Smoking causes changes in the tissue starting in the mouth that can lead to cancer, and those changes can occur all the way down into the stomach and in the GI tract. We're actually seeing an increased identification of cancers in younger people's GI tracts now, and I think a lot of that's attributed to histories of smoking and alcohol use. We do a lot of testing related to the GI tract. One of my favorite tests is the gut health stool test. This is a test that's done at home, thank goodness, because it requires you pooping in a cup, sending the sample into the lab, and then the lab will analyze the different kinds of bacteria that are in there and what they're doing, and give us tools that we can use to improve the microbiome. Food sensitivity panel is another awesome test. It's not an allergy test in the traditional sense that it tells you, are you going to have hives or stop breathing when you eat a food like a peanut or some milk for people who have severe allergies. It's a sensitivity panel. What it tells me is if your body has had an immune reaction to any of about 300 different food proteins. And if it has, it doesn't mean that you're allergic to it, but it does mean that your immune system had to get recruited in order to deal with that food. When our immune system gets recruited for no reason at all, that's inflammation that we didn't need. Inflammation is endocrine disrupting because when there's inflammatory particles binding to our receptors, then the normal good chemicals can't bind there. It fills up that lock with a key, and so the good things can't get in. And so knowing what you might be sensitive to, even if you're not having an allergic reaction to it, can be key at decreasing inflammation in your GI tract. And sometimes our poor GI symptoms are simply because what we're feeding our body is not being tolerated well. It's involving our immune system. It's creating that reaction. And then we feel that as bloating or nausea or decreased appetite or lethargy or a poor mood because our gut is not working well. Hopefully I've given you some tools that you can apply right away to not just assess your GI tract by looking at what's coming out in your stool, but understanding what your GI tract is doing to you and why it's so important to take good care of it, what you can do to increase the benefits of the good bacteria in your GI tract, and what you can do to test if you're having issues with your GI tract, what areas you might be able to evaluate to get better control of your symptoms. You'll see there's some sample reports of some of the tests that we do that I've mentioned in this program. I hope you have a wonderful rest of your day, and I look forward to seeing you tomorrow.